Hi there, everybody. It's Chris again. This is on my spinal fusion. I know I said I was going to do a lot of video posts on this, but the reality is that after the surgery on July 25th, that first week was a blur. I mean, between the pain meds and the muscle relaxants and everything else, getting home, it was just really a blur. I kind of kept a journal on it, kept notes about it. The toughest thing, for those of you that might have this coming up in your life, was really just getting home and getting comfortable. Really, really important to have the right chairs or things to sit on was probably my biggest problem. Most of our stuff is low sofas, low, really comfortable seats, and few issues. So we had to build up some cushions, back cushions, the seat cushions, so that I didn't have to drop down so far or lean into it or lean forward to get out of it. But as far as the actual healing, it's been really rapid. My first week, I got up to walking about 2 miles a day by the end of the first week. They wanted me to be at about a mile. I can do 2 miles every day just walking around the house. By the end of the second week, I was actually averaging 5 to 6 miles every day. I'd go out in the morning. We've got a great greenbelt area behind the house, and I'd do a walk there, do my stuff around the house, and then I'd walk in the evening. I'm a big believer, for me anyway, in trying to get off narcotics, pain meds, and addictive pain meds or muscle relaxants and sleep aids really quickly, and I think I overdid it and kind of pissed off my doctor when I saw him the other day. I was doing really, really well. Absolutely no pain whatsoever. But what happened was I got off of my Percocet, and I stopped using the muscle relaxants because it said for muscle spasms, which I hadn't had any. So by the end of 2 weeks, I'm feeling like, $1 million. I had stiffness, a little soreness. I'd taken the staples out of the back. But I started to develop this incredibly burning tight pain in my left buttock, my left thigh, and right above my left ankle. And it was like, I did some research on it, Googled it like we all do, and it was like the L4-L5-S1 where they had worked. And I didn't know specifically what they had done as far as nerve work. All I knew was that it was the fusion for the L4, L5, and S1. So when I got to see the doctor again, which was a couple days ago on Monday, and we talked about it, and he insulted me. He called me an overachiever and said I'd done this on my neck fusion also, which I'd forgotten. And basically said, and this is something to really take to heart, because the post-op instructions on the meds and stuff really kind of were lacking. But he said for patients with these type of surgeries, if they really want you to stay on for about 4 weeks. And he showed me some stretching exercises to show me just how tight my left side was, and really almost put me in tears. And then he talked about the decompression of the nerve, because apparently the way my L4-L5 had been so bad, because I had absolutely no disc in there whatsoever. There was just bone on bone for quite a while. But it was a little bit tilted, I guess, to the left side and compressing that left side nerve coming out of there. So all that nerve work and decompression was done on the left side, and without the pain meds and the muscle relaxants at night to help everything calm down and not get all inflamed, I actually kind of set my recovery back a little bit, and that's my fault. But it's also a little bit on the medical provider's fault, not just the doctor's office, but at the hospital when I talk to PT and the nurses and his PA. The reality is there needs to be better communication. And I had it with my neck surgery, and I don't know what happened here, whether I didn't ask the right questions or it just got missed. But if you are going to have the surgery, talk to your doctor about those pain meds and how long you need to be on them to ensure that you don't inflame anything. I'm doing a steroid blast pack, which I've done before for my neck, which is pretty cool. Makes you feel like $1 million, but it's really a huge anti-inflammatory, so it's helped that left side nerve a lot. Very little pain in there. I cut back my walking a little bit to about 4 miles a day. The incision is healing beautifully. A little stiffness during the day, but I take a really long hot shower in the morning and let all the muscles loosen up. So I know I should have posted a little more regularly, but the reality is At 3 weeks, just past 3 weeks out, I am doing remarkably well. I walk, I move, I can do the steps, I do laundry. I don't do dishes because I can't get down. I'm still not bending. I wear the brace for comfort only, so if I go out on a long walk, I'll wear the brace, or have to drive, I wear the brace. But for 90% of the day, I don't wear the brace at all. I am careful about the bending. Yeah, they call it BLT, bending, lifting, and twisting, and that's something to remember also. For a lot of us, especially getting in and out of cars, I'm pretty good on squats, so I can actually get in pretty square, but I still use I'll kind of back in on some days if I'm tired or sore, and then it's a full body twist. And you just got to make sure that everything moves together. But it's not nearly as bad as I had seen some videos and some bloggers talk about. This double fusion, I mean, to me, having that pain gone in my back is just a miracle. And you know, I really want to get copies of my x-rays from the doctor because they're really gnarly. I just love looking at all those 2-inch screws in my spine. It's kind of cool. If I get that, I'll post it. If you're having a surgery, or if you've had one recently, you know, post a comment. Let me know how yours is going. I am going to do a little physical therapy to stretch that nerve out in my left side because I'm the overachiever. But I'd love to hear from you. Spinal fusions can be really scary. Some go well, some don't go so well. I think a lot of it really is the doctor you have and the information you have going in. So I'm really pleased. If I can give any information to anybody about this, if you're curious, leave a comment and I'll reply. Thanks so much.